20 minutes after 11 o'clock. Thank you for tuning in. One of these days, we're not going to be talking about cancer anymore, except in history. We'll be saying, once upon a time, there was a disease that was so horrible. It took people's lives, and people lost loved ones, and it was a scary prognosis or diagnosis. Heather Sulzbach is on the phone with us. She is an advanced oncology nurse practitioner, a sub-investigator in clinical trials, so maybe there is hope. She's the recipient of the Long Island Jewish Medical Center's 2005 Nursing Excellence Award in Clinical Practice, and a support system to those living with metastatic breast cancer and their families. She's talking to us about the myths and realities of the BRCA gene, which Robin taught me how to pronounce. BRCA is what I would have said. And the BRCA testing for breast cancer. May 8th is World Ovarian Cancer Day. Heather Sulzbach. Good morning, Heather.
Good morning. Thank you so much for having me to discuss these important topics.
Are you on Long Island right now?
I am.
Where are you?
Manhasset.
Manhasset, okay. I grew up in Merrick.
Little rainy. Oh, yes, good. I love Merrick.
Yeah.
My husband's a Massapequa boy.
Oh, okay. That's from, yeah.
From Malvern. I'm a South Shore girl.
Oh, really? So he laughs like Seinfeld.
Yeah.
Nice.
So tell me about this. When it says myths and realities, what does that mean? What are the myths?
So, firstly, thanks for having me to talk. World Ovarian Cancer Day is an awesome time to really, really open eyes and discuss this disease. And it's typically detected later and when it's a little bit more advanced, and the symptoms are kind of vague and things that can mimic non-cancer things, basic problems, your everyday, tiredness, some bloating, abdominal pain, trouble eating or feeling full quickly. So really, women, let's know our bodies, let's speak to our physicians, let's have relationships with the physicians on an annual basis, and really, I'd love to talk about genetic testing today, which is a huge leaps in what we're seeing in the last, couple of years and the last decade mainly.
And is that the testing that we heard about, like with Angelina Jolie, where you kind of have a heads up, like even before there are symptoms?
Yes, in 2003, Angelina Jolie brought a lot of dialogue and really did increase awareness, and she, was a messenger on this situation and shared her journey essentially. So you can tell in advance for all the cancers, or just breast cancer, or does it apply to ovarian cancer as well? Well, 15% of patients with ovarian cancer have this mutation. So basically, we're getting better and better at genetic mutations, genetic evaluation, right, genetic testing.
Mm-hmm.
And, from newborns, they're doing it in utero, but specifically to today, the BRCA1 and BRCA2, basically they're human genes. We all have them. Their job is to kind of keep the genes in check and help DNA not be damaged. It helps repair damaged DNA, and because if these genes are altered or mutated, if there is a mutation, then the gene, it's not functioning correctly. It's not doing its job at repairing the damaged DNA, and this is how cells could change, lead to cancer. So, like I just mentioned, 15% of women with ovarian cancer have this mutation, and then with someone like Angelina Jolie, it increases the risk of having the cancer, but her choice was to actually try her hardest to prevent. And she did, risk-reducing surgery. But really, once a woman has the diagnosis is when you want to test. We want to make sure all women get tested for the BRCA mutation. We have huge bodies of knowledge, huge national guidelines.
At what age? What age do you test?
So it's not so much an age thing, and it's not so much, if someone has a family history, that's important to know. It's a red flag, and this is how Angelina Jolie learned. But one of the myths is that testing is only needed for those with a family history. Basically, if we rely only on family history or age, it's a poor predictor, and we miss a lot of people that have this mutation, because almost half, so 47% of patients with BRCA-positive ovarian cancer have no significant family history of ovarian.
Oh, really?
Or breast. So we don't want to look. We want to say, when do you have ovarian cancer? Okay, let us know, because we could change the plan, and knowing the BRCA status helps treatment choices such as the types of chemotherapy and use of approved drugs.
And this testing is very important, because I don't know what kind of medical family history scrutiny the parents are put through when they want to go out and adopt their children.
Precisely, and it's not just for women. It's the BRCA1 and 2 mutation can be inherited from a person's mother or father. So each child of a parent who carries a mutation of one of these genes has a 50% chance. So basically 1 chance in 2 of inheriting the mutation.
Oh, really? So what do you do with the information if you find out that your father had the BRCA gene? Do you do anything, or do you wait for symptoms, or what do you do?
So that question is so powerful and has, so many answers, because there's not one way to treat it. Like Angelina Jolie chose risk-reducing surgery, right? And there are medical options, and really it could just be surveillance, because a woman for breast cancer we have a mammogram, for colon cancer we have a colonoscopy. We really don't have effective ovarian screening methods currently for ovarian. So if someone knows that it's in her family, we can do more surveillance. We can do, because just a trip to the GYN for like a pap smear only looks at the cervix. So if we know that the BRCA is under our radar, there will be different surveillances, and it's really fascinating. But although we know that we don't want to rely on family history, because almost half of these people don't have the history, but it is still helpful to know. So we really to know is to knowledge is power.
No, she had a biological child before she decided to do this. Is there a chance that biological child will have received the gene, or does this gene skip generations? No,
there's a risk that that it can be passed on.
But I go back to the age thing, because if you were to test a little child, you wouldn't do anything at that point, right? You would just have the information.
Right. So what we do is test the person that's diagnosed, and then we will have that in the family. If the person is deceased, then it's a different discussion with have a genetic testing done.
Right.
But they wait for after a woman's childbearing, finish, and they'll just, like I said, watch very closely. Maybe sonograms every 6 months, or something for BRCA for breast.
Right,
BRCA.
right.
What they would do is they would screen earlier, so they would start a mammo at 25 years old, when the American Cancer Society recommends a baseline at 35 and then yearly at 40. But if they see that but for Angelina Jolie, she's actually trying to prevent it from ever happening.
Yeah.
So they'll follow her child more closely, and which is more attractive, because we do not have effective screening.
Heather, we're out of time, but thank you so much for telling us about this. Give us a website so we can learn more.
So thank you. So myocjourney.com is phenomenal, and it has everything about understanding the diagnosis down to personalizing the journey from newly diagnosed to whether they're going to be changing treatments and genetic testing, and really speak to your physician about getting genetic tested.
Okay, excellent. Heather Sulzbach, thank you so much for being on the air with us today. You're spreading the word and saving lives probably in the process.
Thank you so much.
Thank you, Heather.
It was a pleasure.
And say hello to Long Island for me.
I will. Eric especially.
We'll be right back.
But in decades, Carnival Cruises Adonia has docked in Havana, the result of thawing relations between the two nations. Passenger Carrie Rybicki.
I know there's a lot of controversy. Some of my friends thought I was foolish, but something I wanted to always we still stopped doing it.
Some 700 people on board, many Cuban-born. It's getting better for builders. Construction spending grew in March to its highest level in more than 8 years. Fox News.